Hi, my name is Arisha, and I attend Nightingale College, and I'm in the nursing program. This video is for my BSN 346 Concepts of Nursing, and I will be discussing things the pregnant mom should avoid doing or taking while pregnant to promote a healthy pregnancy and delivery of her baby. First, I'd like to discuss over-the-counter medication and herbal supplements that should be avoided while pregnant and that should be consumed while pregnant. Some of the over-the-counter supplements, medications, and herbal supplements that are okay to take and usually are promoted by your healthcare physician or prescribed by them is going to be your prenatal vitamins, your folate supplement, iron supplements, your magnesium, fish oil, probiotics, or your herbal supplement like a ginger. Over-the-counter supplements, over-the-counter medications, and herbal supplements that can be harmful to the baby are things like medications like ibuprofen and Aleve. They can cause harm to the baby and also disrupt the baby's development. Your antibiotic Bactrim, your medication aspirin, codeine, those are all harmful to the growing fetus or can be harmful. Some of the herbal supplements I'd like to mention is black cohosh, golden seal, dong quai, yohimi, wormwood, red clover, and yarrow. None of those supplements are recommended to take while pregnant. They all can cause some type of harm to the growing fetus or disruptive development. And it's also good to consult with your healthcare provider before starting any over-the-counter medications, herbal supplements, or just let them know that you're taking them. Usually prenatal vitamins are okay to take, but just always mention anything that you're taking. Next, I want to go over environmental exposures to avoid during pregnancy. I want to discuss a few in particular. First, I'd like to go over secondhand smoke. Secondhand smoke can be harmful to the fetus, can cause preterm labor, low birth weights, and increase the baby's risk of sudden infant death syndrome. Radiation is another environment exposure that can cause health risks if exposed. If the baby gets too much exposure, it can actually restrict cause growth restrictions to the fetus, malformations, impaired brain functions, and also cancer. The mom has to get an x-ray. She should alert the staff of her being pregnant, and usually they'll give her a lead apron to put on while getting her x-rays. The pregnant mom is going to also want to avoid pesticides. Using pesticides and even being around them. Pesticides can cause problems to the fetus, like birth defects, and also can cause the mom to miscarry. Some pesticides can even be passed through breast milk. So even if you're having someone come out to spray your house, it's good to let them know and alert them of you being pregnant so he can take those special precautions. You want to avoid the use of tobacco, tobacco, any alcohol, or illicit drug use. As I mentioned before, with secondhand smoke, same thing with smoking yourself, the mom smoking herself, it can cause preterm labor, the baby to have a low birth rate, and also increase the risk of sudden infant death syndrome. It is good for the mom, and it's recommended for the mom to let the doctor know that she's pregnant during the first visit. You usually prescribe a nicotine patch, and that will usually curb the mom cravings. Alcohol should be avoided the entire pregnancy. Alcohol puts the baby at risk of developing fetal alcohol syndrome, which can cause lifelong developmental issues in the child. Illicit drug use. Illicit drug use can cause the baby puts the baby at risk of neonatal abstinence syndrome after delivery. The mother should consult her healthcare provider for resources on how to quit as soon as possible. It's recommended as soon as she finds out she's pregnant. The travel precautions you want to take is usually the doctor wants you to travel before 36 weeks. It's not recommended to travel anytime after 36 weeks. You're too close to delivery. And if you're traveling internationally, it's usually recommended but somewhere in between 28 to 35 weeks to stop the traveling. You want to travel with your prenatal records. If you're traveling for a long distance, you want the mom is at risk of developing blood clots in her legs. So you want to encourage her to change her position often, stretch her legs out. If she's traveling by car, it's recommended that she stop every couple of hours and kind of walk around for every 10 minutes and maybe wear a supportive type stocking. That's going to increase her blood flow and prevent those blood clots from forming for those long sitting times. You want to avoid countries that where you're puts the mom high risk of catching malaria. And some of those countries are like Africa, Asia, and Central and South America. Places with high altitude should be avoided, and places with known life-threatening blood-borne and insect-borne infections. You want to avoid certain foods while pregnant. And one thing is foods of high mercury fish. The mercury, too much mercury can be fatal to the infant or cause lifelong developmental issues. So you want to avoid that. And some fish that are high in mercury are shark, swordfish, king mackerel, tunas, and orange roughy fish. You want to avoid things like raw eggs that can cause salmonella, which is a bacteria infection. Raw sprouts, including alfalfa, clover, and radish, to name a few. They also can cause bacteria infections. They're raw, so you don't want to eat those while you're pregnant. Any unwashed fruit or vegetables you do not want to consume. You want to make sure all your fruits and vegetables are clean to wash off any bacteria or parasite that could be on that vegetable and then pass to you when eaten. You want to avoid eating any undercooked meat or raw meat or fish. That increase the risk of the mom catching infection from a bacteria or parasite. For example, Toxoplasma, E. coli, Listeria, Salmonella, to name a few of the parasites and bacteria infections the mom can take for if she does consume raw meat or fish. When going and having dental checkups, it is recommended that the mom and encouraged that the mom has dental exams early in the pregnancy. Have her dental cleaning, exams, x-rays. Due to the increased nausea, vomiting, heartburn, and hyperemia, that often leads the mom to having poor dental hygiene and often dental caries. So that's why it's recommended to have a dental checkup early on in your pregnancy and continue those throughout the pregnancy. And we also want to encourage the mom to eat healthy snacks and avoid snacks that's high in sugar. And that too will avoid the mom from having dental issues. So those are some of the things that we can do and encourage the pregnant mom to do to promote a healthy pregnancy and safe delivery of the baby. Thank you.